Welcome to this episode of On the Trail with Frontier Nursing University. My name is Quincy Feeney, and alongside me is Dr. Brooke Flinders. We're going to be touring some buildings on campus that host our Clinical Bound sessions. Clinical Bound is a 5-day skills intensive that our students come to before they begin their clinical practicum.
That's right. I am so excited about this episode, Quincy, because Clinical Bound is such an exciting time here at Frontier. This is when students switch from their didactic learning and they get to come and they do hands-on skills. And so they're with their instructors for the first time, and it gives them a chance to really validate the skills that they have because they're all practicing nurses. Mm-hmm. They all come with a lot of skills, but it also lets them fine-tune the skills that they're worried about if they need more practice on.
And this gives them the opportunity to be vulnerable and to ask questions and to get that feedback from their faculty as well. And we have the standardized patients, so they're working on real people, so they're ready for whenever they get into their clinics that they're working in.
I remember, when I was a student, it is difficult to start over. And what I say to students is they should be patient with themselves because, they're used to being charge nurses. Yeah. They're used to being the ones with the answers. They're used to being so confident, and it's like you're starting over, and it takes time.
Okay, are you ready to go?
I'm ready.
What was your favorite part when you did your Clinical Bound?
My favorite part was the interaction with my faculty members and with my peers. I built relationships that I still have today with both my clinical instructors and my peers. And, it's just a time away from work and family and obligations where you're totally focused on your learning. And that's a pretty unique thing.
All right, we are here in the Learning Center with Dr. Tia Andrighetti. So can you tell us what your role is and what the Learning Center is?
Sure. My role here at Frontier is as the innovation coach and simulation coordinator. So I help facilitate all of the simulations that happen, whether they're virtual or in person. But this building, specifically the Learning Center, is for our in-person on-campus simulations with our midwifery students and our women's health nurse practitioner students. So this is our birth center room, and we have it set up to look like a prototypical birth center so that our students do get practice with an out-of-hospital setting. Many birth centers have birthing tubs, so we include that as part of their simulation experience, as well as having it be a very home-like environment. So you'll notice there's not a lot of equipment around. Most of it's tucked away in dressers, closets, things like that. So the patient and her family can feel very much like it's a home-like environment. This is our home birth room, which allows our students to practice in an out-of-hospital setting. The big difference with a home birth is that they really need to think about preemptory issues that may be happening. Is this client taking a little bit longer in labor, and is that signaling something that we need to be concerned about? And if so, is it enough of a concern that we need to transfer from a home setting to a hospital setting?
I think too, since we have students from every state, it is a unique program in that way. And so because our students are so diverse, we need to make sure that we're preparing them for whatever type of practice they end up in.
So this is our hospital room. Many of our students will spend a good portion of their clinical rotations doing hospital births. So we wanted to emulate everything that they would have equipment-wise within the hospital so that they could get used to practicing with that, as well as still doing the birth, working with our standardized patients who are trained actors and actresses who come in to help portray birth and gives the students practice not only doing the hand skills of the birth, but interacting with the patient, the significant other, the family member who's there with them. So this is our telehealth platform. We happen to use Simulation IQ. And what it does allow us to do is connect our students, our standardized patients, and our faculty in a virtual environment. So all three can be in different physical locations, but still have an interactive simulation experience, which is kind of a unique aspect with Frontier, is that our students are around the country, our faculty are around the country, and yet we still want to give them an immersive, interactive environment while they're learning their didactic courses. So where they're learning to be a midwife, they will have a simulation with a standardized patient, so again, that trained actress, and get to interact with them even before they come to campus and have these immersive environments. So this is our lab area where our students will come and they'll practice a variety of different hand skills. And some of these are GYN, gynecologic related, some are obstetric related. One of the biggest and newest pieces of equipment we have are these simulators that actually will allow the midwifery students and the women's health students to do Leopold's maneuvers. So feel the position of the baby in utero. They actually will simulate the amniotic fluid. So the student has to feel it through the fluid, and we can make the babies breech, we can make them vertex so that they can get practice really understanding the position. It's very important that we keep abreast of the latest equipment that's out there because it is changing on a daily basis. And we want to make sure our students have the best practice they can have prior to a real live patient encounter.
What I hear when I interact with preceptors is that our students are very prepared.
I would agree. I heard that frequently as a regional clinical faculty myself. And I think part of that is the sheer number of encounters we give them across their curriculum. So while they're home doing their didactic coursework, they're still getting simulations. They're still getting practice interacting with patients. They're getting practice making diagnoses, differential diagnoses, coming up with a plan, things like that. And then when they come here on campus, they get to immerse themselves in all the hands-on skills as well as interacting with a patient. And that is the benefit of having a standardized patient program, is that there's a real live human being who has questions, maybe is unsure of something. They need to do that while also doing the birth, doing a pelvic exam, doing a breast exam.
It lets them learn to think on their feet and to start to trust their clinical judgment a little bit, and to do those things that maybe a book can't teach them or that a test can't measure necessarily.
And this is what we know is making us safer as patients when we go access healthcare, is that students are having practice interacting, practicing being less than perfect in a simulation center, simulation lab, and then hopefully they've had some correction of the skills that need to be corrected before they go out and take care of real life patients.
I, like so many students, I was really confident as a labor and delivery nurse. I was not confident at all as an advanced practice nurse or a nurse midwife. And so, that interaction and that time with faculty, face to face, to just be alongside you was critical. Can you say a little bit from your standpoint about clinical bounds and the importance?
Yes, so we have a very low student to faculty ratio while students are here on campus, so they can get that immediate feedback, that correction of hand placement, the order that they're collecting specimens, things like that. We also have the faculty during the simulations play the role of the preceptor. So they're getting used to the preceptors that they'll have in their clinical rotations, and where does my knowledge stop? Where do I need to kind of confer with my preceptor to make sure that I'm on the right track? So they get practice doing that also while they're here.
The other thing that I feel like is important is that it's so individualized in some ways. I came in really confident in some skills, and so I didn't spend a ton of time preparing for those or getting checked off with those. Those went quickly. But the areas that I really needed to focus on, I had the time to focus on here. Would you say that that's a common thing, or that you have students with all different levels of experience?
We do have students with all different levels of experience, but that's the beauty of a competency-based system, in that once you feel that you're competent and the faculty feel that you're competent, you can go on and you can spend more time doing the skills that you're not comfortable with and taking the extra time. So this is the room that we simulate as an office visit for our midwifery students. So a gynecological visit, a return OB, we have a standardized patient play the patient, but when it comes to the exam, they'll do the exam on a pelvic mannequin or a breast mannequin to allow for some privacy for our standardized patients. That allows the student to practice, gather specimens. They can look in the microscope, determine if there's something abnormal going on there.
And so is this the same equipment that all your students use, whether they're nurse midwives or women's health nurse practitioners?
Correct. So when it comes to the office setting, they would look the same for both practitioners, so we give them the same equipment in which to practice.
Thank you so much for joining us today here on our Frontier campus. The simulation experience is so important, and clinical bound is so important for our students. Our faculty do a fantastic job of supporting them, and as you can see, it's important to our students.
So that's all we have time for today. On our next episode of On the Trail, Dr. Flinders will be in Atlanta on the road, and we will see you then.